Good afternoon, or shall I say good evening. Biblical Perspective Healthcare Delivery Systems Block 2. This is a YouTube video on long-term care funding. We know Medicaid and Medicare are now two major public funding sources for long-term care. However, the circumstances under which elderly person receives long-term care assistance is very different. Persons who receive long-term care assistance from two public programs generally fall into two categories, which is Medicare enrollees who are recovering from an acute illness, and of course the poor elderly person who are eligible for Medicaid and who qualify for Medicaid covered long-term care benefits. Also, there are like six ways to pay for long-term care funding. One is self-pay, of course. It comes with a hefty price tag. In 2017, as I'll submit with this video, I believe on slide 3 is going to tell you what the breakdown is for home health aid services, homemaker services, adult daycare health services, assisted living facilities, semi-private room, nursing home care, as well as private room home care. You'll be able to assess some of those costs on slide 3. Also, there's government benefits. Many retirees believe they think that Medicare will pay for the long-term care. Unfortunately, this is not true. That's one of the biggest misconceptions. Although Medicare covers some nursing home care, it is only for rehabilitation purposes and not categorized as long-term care. Some veterans, there is some pension with aid and attendance available, but the amounts are contingent upon single or married. And you can see those benefits as well on government benefits to assist with long-term care on slide 4. Also, one of the other ways to pay is traditional long-term care insurance. This choice has been around for decades, of course, but it's no longer a cost-effective way. Things have changed over the years, and I give a better breakdown of it on slide 5 as well. Traditional long-term care insurance today, it may lead to regret in the future. Why? With rising costs, rising policy premiums, stricter state reserve requirements. There aren't a plethora of insurance companies to choose from anymore. Financial burden from it is just not sustainable for some insurance companies. Also, you have what you call combined life insurance with long-term care benefits. One option retirees are using is combined life insurance policies with long-term care benefits, also known as like a rider. Not only are there similar features available, inflation protection and different elimination periods to choose from, but if you pass away prematurely, your beneficiaries receive a tax-free death benefit. Only biggest difference you should be aware of is whether the policy has either a chronic illness or long-term care rider, which will affect that, right? So there's all kind of caveats to trying to pay for long-term care. Last but not least, usually we get these existing life insurance policies, whether term or permanent, and we think as we get older, we should just let them go. But you can take that life settlement, which is a life insurance policy, and use it towards financial costs for long-term care. In conclusion, what I would like to say is this, these different options for long-term care, and with the rising cost of healthcare, no one really knows what cost would be when we reach our age, or our age where we need long-term care, or the age of 65, which is normally the quote-unquote age that is looked at. So I believe it's essential to plan and try to have as much financial assistance as necessary to combat the ever-increasing cost of healthcare and long-term care. My name is Louis Lopez, Healthcare Delivery Systems Block 2, Professor Hartigan's class. This is my conclusion on long-term care funding. Thank you.